Dr. Richard Vautrey is chair of the British Medical Association's GP committee, and he joins us now. Will GPs be able to cope, first of all, with opening 12 hours a day, 7 or 8 days a week?
Well, we'll certainly need the support of the rest of the NHS, both locally and nationally, to be able to do so. But GPs have a track record of delivering mass vaccinations. We're currently embarked in one of the biggest flu vaccination programmes that we've ever done. But this is quite significantly different from that, both in terms of the logistics, the type of the vaccine, and also sort of the speed with which we'll need to do it. But GPs very much, with their teams, will be wanting to do the best for their patients.
Well, let's look at those logistics. First of all, there is the getting the vaccine to the surgeries. It has to be stored at this incredibly cold temperature, doesn't it, which most surgeries won't have the facilities for. How would that happen?
Yes, well, there are a number of vaccines that are likely to come. Obviously, we heard the good news of the progress that Pfizer have made with their vaccine, but other companies are producing vaccines which will have different characteristics and different storage requirements. But nevertheless, you're right, the vaccine that is currently potentially coming to us will require deep freezing. It will, once it's defrosted, have to be given within just a few days. It will need special drawing up. And so that's why we'll need to work with a whole range of different people. It won't be as simple as the flu campaign. And that's one of the reasons why practices, certainly in the first instance, will have to work together in their local area, working from maybe a single site, so that we can maximise the use of vaccine as and when we get it.
So do you think that sites will be set up that are separate from surgeries, or do you think that all will congregate at one surgery?
We would hope that we would be able to identify at least one suitable site, probably a big surgery within a local area. In some cases, that might not be possible. It might be a local authority building, sort of, it might be other service areas, sort of, such as a sports hall that is used. But obviously, we need to work with local partners on the ground to find the best and suitable place. But then that would be staffed by local practices. But clearly, they also need to continue with the other work, the other vitally important work that we do at this time of the year, supporting not just patients with COVID symptoms, and that's an increasingly challenging problem right across the country, but also the people suffering from winter flu and other types of illnesses, as well as those with chronic conditions. So practices are already working significantly to cover the work that their patients bring them sort of on a day-to-day basis. So that's why we will need the help and support and understanding and patience of everyone at this difficult time.
And in terms of the jab itself, anyone who's had inoculations will know that some are quite straightforward. Some really hurt your arm and, you feel lousy for a few days afterwards. Do we know anything at all about this one, how it will be to administer, what it'll feel like to get it?
What we understand, and as I've said, there are a number of vaccines coming through, and each may have slightly different characteristics. But we understand that it will potentially cause more of an achy arm than the flu vaccine did, and potentially a slight temperature, which would hopefully settle with paracetamol without too much trouble. People will need 2 vaccines. They will need to attend for both to get the maximum benefit from the vaccine. But that short-term discomfort is going to be far outweighed by the significant gain of protecting you from a deadly infection, particularly amongst our most vulnerable patients.
And in terms of this second vaccine, what would be the gap between the first and the second?
Again, it would depend on which vaccine was being given, but what information we've seen is it's roughly going to be between 3 and 4 weeks between each doses. So people would need to commit to come for each dose so that they can get the potential benefit from the vaccine.
How has it been being a GP in the last few months? You've not been able to see a lot of patients face to face. A lot of people have been seen remotely. In terms of the volume of work that GPs are facing and the kind of work that GPs are having to deal with, what is the picture?
Well, as with all those working within the NHS, GPs and their practice teams have been open throughout the pandemic. We've been seeing patients who need to be clinically seen face-to-face in our surgeries throughout the pandemic. But we're also, as you know, increasingly talking to people on the telephone, providing digital access to surgeries. And the latest data shows that we're actually seeing and contacting far more patients than we did at this time last year. So practices are under huge pressure. And we started this pandemic with insufficient numbers of GPs, practice nurses and other support staff. So we were already struggling with our workload pressures. We do need understanding of our patients. We know it's not necessarily what they would want. They would want to be able to walk into a surgery relatively easily in the way that they used to do. What we can't have is crowded waiting rooms with people potentially spreading a deadly infection. And we need to ensure that every patient and all our staff are safe. And that's why we're working in the way that we're doing.
Anecdotally, some GPs have told me that the one thing that they are dealing with at the moment in huge numbers is mental health issues. Is that something that's reflected across the board, that there really seems to have been a big increase in this since the coronavirus epidemic?
Yes, there has. It's something that GPs and their teams are really concerned about. We know that large numbers of people have suffered mental stress as a result of isolating away from their family, not having their usual social contacts, but also their worries about COVID infection or potentially other things that they've been living with, other chronic conditions and serious illnesses that they're worried about, or delays in their treatment because the hospital hasn't been able to offer them the timely appointment that they would have expected. A whole range of factors are playing into this, but it is leading to many people being worried and anxious, and GPs and their teams are there to support people and have been throughout this time.
Dr. Richard Vautrey, good to talk to you. Thanks very much.
Thank you.